Hi everyone! In this video, we're going to talk about how to assess for an acute inflammatory condition. So let's get started. An acute inflammatory condition is a sudden onset of inflammation that typically lasts for a short period of time. To assess for an acute inflammatory condition, we need to look for clinical signs and symptoms, laboratory tests, and imaging studies. So first, history. Ask the patient about the sudden onset of symptoms. Is the pain localized or widespread? Is there redness, swelling, and warmth at the site of inflammation? This is called local inflammation. For example, redness, swelling, heat, and tenderness over the right lower quadrant of the abdomen, suggesting appendicitis. Are there signs of systemic inflammation? This includes fever, fatigue, and malaise. A history of infection, trauma, autoimmune disease, or exposure to irritants or allergens can be helpful in identifying the cause of inflammation. Next, physical examination. Look for localized signs of inflammation, such as redness, swelling, heat, and tenderness. Also look for loss of function in the affected area. For example, if there's inflammation of the knee joint, there will be redness, swelling, and tenderness around the knee. The patient may also have difficulty walking or bending the knee. In addition, systemic signs of inflammation, such as fever, tachycardia or increased heart rate, and hypotension or low blood pressure may be present, especially in severe cases like sepsis. Then laboratory tests. A complete blood count or CBC with differential is a good place to start. An elevated white blood cell count or WBC, particularly an increase in neutrophils, is seen in bacterial infections. An increase in lymphocytes is more common in viral infections. And eosinophilia is seen in allergic or parasitic conditions. Elevated inflammatory markers such as C-reactive protein or CRP and erythrocyte sedimentation rate or ES are nonspecific but very sensitive indicators of inflammation. Procalcitonin is another useful marker. It's a protein produced by the body in response to bacterial infections, a useful test that can help distinguish between bacterial and viral infections. Other tests such as liver function tests or LFTs and renal function tests may be helpful if there is a suspicion of liver or kidney involvement. In cases where infection is a concern, blood cultures may be warranted. Lastly, imaging. If the cause of inflammation is not apparent or if there are concerns about organ involvement, imaging studies such as X-ray, ultrasound, CT, or MRI may be necessary. For example, pneumonia, appendicitis, arthritis. An echocardiogram may be indicated if there is a suspicion of endocarditis. And joint aspiration may be helpful in diagnosing septic arthritis. And finally, specialized tests if an autoimmune or other cause is suspected. Tests such as anti-nuclear antibody or ANA, rheumatoid factor or RF, and anti-cyclic citrullinated peptide or anti-CCP may be useful. In addition, allergy testing may be helpful in cases of suspected hypersensitivity reaction. Remember, this is just a general approach to assessing for an acute inflammatory condition. The specific tests and investigations that are needed will depend on the individual patient and the suspected or clinical diagnosis. I hope this video has been helpful. If it was, please leave a like, and if you have any questions, please leave them in the comments below. Thank you for watching.